everyone. Today we are going to learn about personal protective equipment, how to don and doff. Don mean how to put on and doff mean how to remove. So what is PPE? Personal protective equipment. It's a special equipment to create a barrier between you and germs. So it will create a barrier between you and germs, protect you from chances of touching, being exposed to, and spreading the germs. So PPE includes cap, mask or respirator, goggles or face shield, gowns, gloves, and in some cases the foot cover. So you should wear the personal protective equipment PPE according to the guidelines and protocols set by your organization or according to the procedure that you are going to perform. So these are all PPE for the healthcare workers to use. First, the gloves. Gloves should be worn when there may be exposure risks to blood, bodily fluids, secretions or excretions, and when handling contaminated equipment. So gowns should be worn to protect uniforms and clothing from moisture or soiling during direct patient care. And face shields or goggles should be worn when there is risk of body fluids splashing onto mucous membranes like eyes and nose. Eyes can be protected by wearing either goggles or a face shield. So the masks or respirators should be worn to protect the healthcare worker from splashes and droplets to the area of the healthcare worker's nose, mouth, and respiratory tract. They do not provide protection against airborne particles for surgical masks. So we are now start to put on the PPE. First, you should remove all the accessory like watches, rings, and earrings. So I start to remove all to start. Alright. And then we should perform the medical hand hygiene by following the 7 steps of hand hygiene: palm to palm, hand interlace, hand interlock, thumbs, the tip of your fingers, and also the rings. And remember that it should last at least 20 seconds to perform medical hand hygiene. So we start to wear the gowns. First, before you wear, you check for any defects, full functioning, and then you wear the gowns. You tie the necktie. In some cases, there may be somebody else to assist you to tie, like operation theater. But if there's nobody, it's okay. You make sure you totally cover your clothing and make sure there's no space behind. So you tie the back tie. And do remember, you perform hand hygiene between each step. So first, I want to show you wearing surgical mask first. As your hand is clean already, you take the mask and then you put on each of your ear. And then there's a metal bridge there. You make sure fit into the bridge of your nose. show you how to wear respirator or N95 mask. So you should test before you wear the respirator or N95 mask according to your size. So before you're supposed to do the mask fitting test, which will exactly fit to your face, and you should use this size whenever you use the respirator or N95 mask. So to don, we hold the cup like this, and then you position it to your face and put the first strap to the crown of your head, and then pull the second strap to the back of your head. You can adjust the strap accordingly, and then you position the nose bridge and the chin, and you try to breathe in and try to blow out the air and feel the air here until you cannot feel the air at all. If you can feel the air leaking out, you may need to reposition or readjust. So I use the mask according to my size, because before I have tested mask fitting text before, so it's perfectly fixed to me, and we can leave it there. So before I try to don face shield, I will perform hand hygiene. So now I'm going to don face shield. So the face shield, for the face shield also, you should know your sizes before you're wearing it, and it's simple as that. You can wear from the strap here. Remember, the face shield should be at the middle of your forehead and cover the chin here to protect from the splashes. So I perform hand hygiene again. Press the glove to cover your wrists, and there's no exposing of your skin between gowns and the gloves. So for doffing, removing the PPE, we start from the glove. So you grasp one hand with the glove and take out, and the other hand you remove inside out and throw straight away. And then perform hand hygiene. And then you remove the face shield. If you have to reuse it, you place in a designated Ziploc pack or designated area, and then you clean it and you can reuse it. So I'm going to remove the respirator. First, remove from the second strap, and then you hold it here, and then remove the other strap, and then you throw it straight away. Okay. Remove the gowns. from your body by touching the inside only and turn into this way, and straight away you throw to the designated area and heighten. Okay, we are done.